फिर बाद में आप लोग अपना सवाल भी पूछेंगे. So the first question is, you mentioned about some indigenous devices that the institute is developing in collaboration with IITs and other, technological institutes. And subsequently also in the discussion you also mentioned indigenous devices, and so did Dr. Chandrasekhar. Is there any specific example of one such device which was indigenously developed in our country in collaboration with some technical institute and which has made a difference for interventional radiologists?
As far as I know, actually till now there is no such device, but actually myself is collaborating with IIT Delhi to develop such stent. Maybe in a year or so we will be able to manufacture some prototype so that we can be launched. Okay. And in the meantime also there are so many companies which are already into, because Make in India is a buzzword now, and all are, and maybe in the 1 or 2 years we will get to see most of the stents and balloons will be made by the Indian companies.
In KEM Hospital, Mumbai, and I was working with my colleague Dr. Kranti Kumar Rathod, and together we have devised a medical stent which will reduce obesity. And this design of the stent was approved by the US Patent Office, and we have been granted the US patent for this medical device to reduce weight in obese patients in April 2021. Once we have got the patent, we will further upscale it and see to it that whether this device is feasible, whether this device can be manufactured, whether this device will help us in minimally treating patients with morbid obesity. This is the only case that I know of a medical device which has been approved by US Patent Office till now amongst our interventional radiologists. There are many more in pipeline, and which we would subsequently see to it that we mentor each other and develop such devices in future.
We have probably the only device in the world which was manufactured and designed by an Indian company and Indian doctors, and I was incidentally involved in the whole study project. This is a device which is what we call as bioresorbable stent, and that stent, the important criteria was that there was a drug on it also. So that helps to treat this peripheral vascular disease, and we were the first people in the world which we used it in humans, and that paper was accepted in Germany and in Paris, where we presented our data, and is now acceptable, and now it will be all on a manufacturing front, and within a year or so this will be available not only in India but all over the world. So credit goes to that the Indian brains and Indian minds have worked on it and have been successful in treating these patients. So the name of the device is Credence BTK.
So regarding especially the training in interventional radiology, Tata Hospital is the first institute which has got a 3-year Medical Council of India certified DM in interventional radiology course. So we started around 4 years back. We started with 2 seats in DM in interventional radiology, and recently we got approval from the National Medical Council, which is now with MCA has been replaced by National Medical Council. It has approved 4 seats of DM in interventional radiology, which is the first institute in India for training the students after MD in interventional radiology.
And in terms,
to add to Sir's thing, if you take interventional radiologists in entire India, 80% of them are trained in Bombay and from KM and Tata.
Wow, great. In terms of industry impact, do we have any study which gives the number of cases that are being treated through the process of interventional radiology in this country? and what is the kind of impact it has in terms of on the industry in terms of numbers and size, and at what percentage is it growing every year annually? How many people are adopting for this kind of treatment? Is there any proper study on this? And if so, what do these studies reveal?
So this will what we call as registry data. Rather than the industry, it is the society which handles this. And we do have our registry data collection every year. And as we have understood it over the years, there is an average of 8 to 10% increment in number every year. And today I would say that, as somebody mentioned, that we have more than 1,000, about 1,100 members in our society. There is an average number of procedures that are being performed in interventional radiology is more than 50,000 per year in India. So the numbers are ever growing, and I'm sure the jump will be now much more, and that's where the media will play a role. We want to reach out to the people and tell them there is this branch of medicine which can be taken and can be helping in the treatment of a lot of patients. So the growth is very rapid. Lot of new technologies, lot of new techniques are being developed, and the growth is very rapid now.
We may be small in number, but we are available everywhere. It is your right when you reach to the hospital and you say, I have chest pain and I need to see a cardiologist. It is your right to ask for an intervention radiologist. If you create awareness through media, surely intervention radiologists are now not just operating, we are available for consultations also. So we are available for you to come across the table and discuss on consultations, how you consult your general practitioner. So we are available across the country. You have to ask for that.
Yeah. So the last question, sorry, you want to add?
To clear your doubts here, I have done fellowship in 2006 in KEM. So whenever there is a patient of aneurysm or anybody who comes into KEM, or he has been given an option of neurosurgeon, interventional radiologist, always. So we used to discuss with the patient that these are the options and these are the benefits of these things. Coming from there, I am now practicing in Apollo Hospital, Hyderabad. Even today, all the patients are being given the options. Which doctor do you prefer? These are all options available to you. So the doctor never decides for the patient. And once the patient has the knowledge that I want intervention radiologist, they cannot force you to go for surgery or anything. So it is always knowledge, 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 awareness and knowledge.
Right now we are overloaded with work, and with lots and lots of time to scrutinize our work. I believe we will soon become a developed country in terms of health also. So this is a process. This is not going to take maybe in next 2 or 3 years it will happen. This will take a decade or so. 10-15 साल 20 साल लग सकते हैं इसमें, and I believe we will soon become a developed country in terms of health also.
Also, as a society, we will be coming out with some consensus guidelines and quality improvement guidelines. As Dr. Vimal has said about this meeting, we'll come out with the complications, how to prevent them, as well as what can be the thresholds of complication, so that below that threshold we should remain, so that we can give safe treatment to the patients. So all this data will come out over a period of time, and that is how patients will get this information.
आप देख रहे हैं सक्षम न्यूज इंडिया, सबसे पहले सबसे तेज।